of patients do still die in some sort of healthcare facility. And dealing with the end-of-life healthcare needs for a dying family member, well, it isn't easy either because of cost or time. Hospice care might be the only viable option for many patients. So what should you know about caring for someone with end-of-life healthcare needs? What should you look for when picking a hospice? And how much money does Medicare give patients for their end-of-life care? Rana McClelland is the president and CEO of Houston Hospice, and she's here now to discuss these and other questions. And we welcome yours as well at talk@houstonmatters.org, or you can call us at 713-440-8870. Rana McClelland, welcome to Houston Matters. Good morning.
Well, thank you, Craig. Happy to be here.
So Houston Hospice is, as I understand it, the only nonprofit hospice in the Houston area. Is that correct?
Well, we're the only freestanding nonprofit hospice. We're not affiliated with a hospital system.
Right. How are nonprofit hospices different from for-profit ones, other than obviously for-profits are trying to make money?
Well, most people associate nonprofit hospice obviously with quality of care, and that's certainly not the only thing that makes us different. It's one of the things that differentiate us from the for-profit hospices. It stems from the inherent mission of nonprofit hospice. Houston Hospice is accountable to the community and not shareholders or privately held interest groups. We can spend more time with each patient family, add specialty programs for children and veterans. We provide care with expertly trained hospice boarded physicians. And through generous donations, we care for many, many unfunded patients in the community of Houston. Also, our community donations, which we receive as a nonprofit, support our high-tech, high-touch care in our 33-bed inpatient facility on the Texas Medical Center campus.
I was surprised to learn that somewhere around 2/3 of hospice agencies are for-profit. Does it surprise you that for-profit agencies outnumber nonprofits when it comes to something like this?
No, I think being a nonprofit is a specialty. Again, like I said, the most significant difference between nonprofits and for-profits really lie in our purpose. Nonprofits have an altruistic social mission, and we provide services needed by the society and most often our local community. It's not just a tax status difference. I have worked for some for-profit hospices, and at that time I kind of thought that was what really the difference was. But we thrive not only from government-funded agencies like Medicare and Medicaid, as our for-profit counterparts do, but our generous donations from the Houston community allow us to provide services above and beyond.
Most Americans, as I said, say they would prefer to die at home rather than in a hospital or a nursing home. Of course, once the moment is coming, that's not always an option. And in some cases, those attitudes may change depending on where they think they might be able to receive the best care in the moment. But do you and do other hospices provide at-home care?
Craig, you mentioned nursing home. Let me just say that all hospices provide care wherever the patient is. And that could be a nursing home, assisted living. It could be an inpatient facility. It could be under a bridge. But certainly the majority of people receive care in their home. It may be their loved one's home. It may not even be their own home. So we all provide care in a multiple number of settings, and home is wherever the patient is.
Is at-home hospice care something that's affordable to everyone?
Well, it is affordable to everyone. I mean, like I said, the majority of our funding comes from Medicare, Medicaid, private insurance, and in our case, whatever may not be covered, and if you are not funded or you're a charity patient, we would provide care for you as well. We recently hired someone, and I remember him telling me that he worked for another for-profit agency. And he said anytime there was a patient he couldn't serve or a high acuity patient that they didn't have the skills to serve, he always knew Houston Hospice would take that patient. And I'm very proud to say that we do have experts here, and we're, because of our social mission, we're very happy to be able to serve each and every patient regardless of their ability to pay.
If you're a loved one who has someone in your life who needs hospice, what should you know about caring for someone who has those end-of-life healthcare needs?
Well, I would say first and foremost, advocate for yourself and your family. Oftentimes, patients are not receiving hospice care for more than days to weeks, and the hospice Medicare benefit allows for 6 months or less. So the majority of people that receive hospice care only have it for a short time. There's nothing wrong with asking your doctor, could I have a hospice referral? And there's certainly no reason why you couldn't call us at 713 Hospice and ask us, do I qualify for hospice? I would like you to come out and do an evaluation on my family member and give you some kind of idea of where you qualify and where you're at in the journey.
Well, there's your evaluation of their circumstance, but then there's also their evaluation of you. What should, and I realize you're going to point to things that you do, but what should any patient or a loved one of a patient who may need hospice care, what should they look for in hospice? Are there particular factors that, and do you have much of a choice about where you go?
Well, you do have a choice. And often I don't think in healthcare we realize that. You get to choose your healthcare provider just like you choose your physician. You get to choose your hospice. And I would recommend, just like anything else, as a baby boomer myself, looking for services, I would go to the Medicare.gov website, and all of the quality reporting is out there on the internet for you to be able to compare Houston Hospice to any other hospice in the greater Houston area and see for yourself what are patients and families saying about the quality of care. And I think that you'll be pleasantly surprised that Houston Hospice has quality of care above the national average and much higher than our counterparts in the Houston area.
This is Houston Matters. I'm Craig Cohen. We're discussing end-of-life care with Rana McClelland from Houston Hospice. We welcome your questions and comments at 713-440-8870. You can reach out on Twitter at Houston Matters. You can email us at talk@houstonmatters.org. Most patients don't get the chance to die at home. What are some of the factors that go into that? Why do you think that's the case?
Well, I think most likely it's because of a late referral in the healthcare system. People don't know they qualify for hospice. I think there's myths behind the thought of hospice, but often we have patients and families tell us that they wish they had known sooner. It's very difficult when you're in the active stages of your disease process to let go of that care and grab onto the baton of hospice and palliative care. And so there's a trust, transition. But most patients are very happy that they're able to live and die with dignity and in their own home.
Well, that trust factor isn't just with patients, but also with their loved ones who have been caregivers for them, possibly in some cases for quite some time. For those caregivers, how much of a challenge is it to step aside a little bit and allow hospice care to not to take over, but you know what I mean, to deal with some of the things that may be helpful, and I imagine in some cases it's really beneficial too.
Well, we certainly partner with the caregiver. Hospice, is a part of the family, not the family, and so what we want to do is try to provide care not only to the patient but also to the caregiver. Even 18 months after the patient has passed, we still provide bereavement services. So, often when you only have hospice for days to weeks, you're able to access some of the other services like the social worker and the chaplain and some of the services that are so needed for the family.
Let's take a call. We have Scott on the line from Houston. Scott, what's your question for our guest?
Hi, yes, I just want to see you.
Go ahead, Scott.
Can you hear me?
Yes, we can. Go ahead.
Okay. I just wanted to see if you could give some insight into kind of the level of service that hospice does to provide to individuals.
Well, there's
on a day-to-day basis.
Well, it depends on the hospice, but I will say generally, hospice is an interdisciplinary type of care. So there's a physician that's part of your team, nurse case management, social worker, chaplain, and very often a CNA. And the amount of care that you might receive for your particular loved one depends on their individual situation. So every patient has an individualized care plan, and the family and the patient dictate what kind of care and how that will be directed.
All right. Thanks, Scott, very much for the call. We appreciate it. I'm curious about what impact the hospice industry saw from the pandemic. How did that influence the work that you did over the last couple of years?
Well, certainly we were in already geared for the business of critical care. Having said that, there were a lot of things out on the internet about people leaving their employment to look for something meaningful. And I will say from the Houston hospice perspective, we all find such great purpose in the work that we do here that we didn't see that. We certainly have had challenges like every healthcare institution has, but we really bonded together, worked together. We really tried to instill some wellness programs to try to support our caregivers. Because we were very aware of the fact that they were feeling compassion fatigue, along with giving to these patients and families who are experiencing not only COVID, but end-of-life issues as well.
We have a tendency, I think, to think of hospice care as being an issue that is strictly for people who are elderly. That when we say end-of-life, we're thinking of very old people. But in fact, that's not all, right? I mean, there are programs, services you provide that are specific for younger patients as well.
That's true. And unfortunately, this topic we're talking about today can impact anyone at any stage of life. We have a specialty program for pediatrics. It's called our Butterfly program. And we're fortunate enough to also work with a board-certified pediatrician and hospice physician in one. She leads our team, as well as we have specialty pediatric RN case managers that lead our pediatric team. And we carry 20 to 30 pediatric patients at any given time, and it's a unique thing to Houston Hospice.
That's Rana McClelland. She's the president and CEO of Houston Hospice. Rana, thank you very much for joining us.
Thank you so much.
And still to come, why filmmaker Ty West's new movie